Last month, aged care worker and union delegate Michelle was on her way from Bulli to Canberra to lobby for better pay and conditions.
They need to realise that there is a problem with our wages.
Her concerns go to the heart of the problem with aged care that has been deepening for years in Australia, first provoking a Royal Commission and more recently brought into even sharper focus by COVID, a crisis in the workforce.
About 70% of the money that's spent in aged care is spent on the workforce, and that tells you the significant contribution that a high-quality workforce has to high-quality aged care.
1 in 5 plan to leave in the next 1 to 5 years. We're coming off a baseline of chronic understaffing in the sector, and we know we need to keep the people that we've got and then grow the workforce. So it is concerning.
Yeah, exactly.
You know, the worst times, it's hard. The residents can see that we're run down.
At the end of next month, the Fair Work Commission will hear the first ever work value case for aged care workers under the modern award system, both for carers and nurses. You may have heard politicians and others speaking about how carers in the sector are paid less for looking after our aged family and friends than staff at Bunnings or Woolworths. The headline you may have heard about in this wage case is that there is a push for a 25% pay rise. But the case is about a lot more than that. Lynelle Briggs was one of the Aged Care Royal Commissioners.
Nurses in aged care are paid less than nurses in other fields employed by state governments, and I found this an extraordinary discovery. Nurses in aged care have a much wider span of control than most nurses working in the wider health system. They're expected to manage a lot of staff, and not only that, to really know a lot about a range of very chronic healthcare conditions. And this, in the view of the Royal Commission, justified at least equal pay between nurses working in aged care and those in hospital systems.
We see a pay disparity of anywhere between, for what we would call your entry-level registered nurse, anywhere between 25 to 30%, up to your highest level, we'd call it a registered nurse level 8, up to 48% pay difference between the two sectors for doing equal work. And it's on that basis that we think a 25% pay increase is very much justified.
There is also no wage structure that recognises skills or training and therefore gives people senior roles to aspire to, a clear path to get there, or rewards for becoming a specialist in a particular kind of care.
Improvements in classification structures that recognise the experience and qualifications of those people working in direct care in the sector, particularly personal care workers, but also nurses.
A crucial recommendation of the Royal Commission was that the Australian Government and the aged care sector should reach a consensus to support applications to the Fair Work Commission to improve wages. A consensus position was reached by almost everyone in December.
So we had a historic discussion where we had aged care employer groups, aged care union groups, and also consumer representative groups come together.
I would say that the process was robust, and I think that will certainly give some comfort to the Fair Work Commission about the support for this proposal.
But there was one party that was noticeably absent from the consensus position, the federal government.
It's my view that the government should support its work and the case that's been agreed and put forward by the unions and the employers.
Well, the federal government was invited into that conversation with the unions and also with the consumer groups, and they chose not to participate. That's on them. But at the end of the day, they are a clear party here. I mean, they fund 80% of the sector.
And there's the rub. Taxpayers will ultimately have to pay for this increase through subsidies to the sector, so government has a crucial interest in what happens in the Fair Work case.
I wasn't surprised that government didn't participate in recommending an actual level. However, I am confident that where the Fair Work Commission arrives will have to be funded by government, whoever is in government.
With the government so far declining to be involved in the Fair Work case, the future of the aged care workforce appears a clear point of difference between the political parties at the looming election.
Labor's position is that we understand nothing is going to change about aged care until we address this pivotal issue of the pay of aged care workers. So we are going to abide by the Royal Commission's recommendation to go hand in hand with workers, with providers to Fair Work.
In response to questions from 7:30, Aged Care Minister Richard Colbeck said Labor had not been specific about the size of a pay increase, which is, of course, to be determined independently by the Fair Work Commission, but did not respond directly to the question of why the government is not making its own arguments in the case. It's not as if addressing these sorts of pay inequities and glaring workforce problems hasn't had to be confronted by governments in the past.
But this is also one of the wards in which second-year student nurses have to work.
We both came straight from school.
A push to professionalise the general nursing profession took place decades ago.
One solution is for nurses to become independent practitioners.
Any other suggestions? Just rest, I think.
It took a while, but eventually a university-based nursing education course was established, with extra training units rewarded with more pay, in an overhaul which properly established nursing as a profession.
In the hospitals, we have clinical education roles, we have advanced practice roles, so clinical nurse consultants.
There's lots of complexity as various forms of chronic conditions and diseases interact, and different pharmaceuticals come into play, and a heap of allied health services.
Such profound changes obviously come with a big price tag. The Royal Commission didn't insist everything had to happen at once, just that a clear timeline and intent be set out. But the pressure to move quickly is intense when current conditions are such that experienced staff are leaving the sector, even as an ageing population demands that it grow.
There is an overwhelming sense of frustration and fatigue in the workforce. We are seeing an exodus of senior staff. These are people that have been in the sector for many, many years, filling senior leadership roles, and are finding it just all too hard now. And in a time when we need leadership in a pandemic, that's a concern.
For Linnell Briggs, there is also a more significant message to be delivered in the way government responds to the case.
And it needs to do this because it needs to put actions behind its words. Now, in my view, the government needs to address a very discouraged, downtrodden and largely female workforce and support it.
Who else will do it? If I step away, who's going to step up and do their needs? So right now, quitting's not an option. Trying to get the aged care crisis under control and fixed is everyone's priority right now.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.